Can drugs cause hoarse voice, and if so, what drugs can cause hoarseness? In this video, I'm answering these questions, so stick around because we'll start right after this. Hi, I'm Katarina, speech-language pathologist from How to Improve Singing, and here on this channel I share practical tips about using your voice in a healthy way. So, if this is a topic that interests you, consider subscribing to this channel and hitting that bell notification icon so that you don't miss any of my videos. Okay, you've been experiencing hoarse voice, and now you are wondering if your voice problems can be caused by the medication that you've been taking. Can drugs cause hoarse voice? And the answer is yes. Some meds have known adverse effect on voice and speech, and they can be both prescription drugs or over-the-counter drugs. You may be taking some of these drugs on a regular basis to manage a condition, illness, or disease, or you may take these drugs only occasionally, for example, when you have pain or cold. There are several groups of drugs that cause hoarse voice, but in this video I am going to tell you about 3 groups of very common drugs that cause hoarseness. Number 1, allergy medication. Allergy medications such as Claritin, Benadryl, or Zyrtec contain so-called antihistamines and decongestants. These medications basically calm your immune system's reaction to allergens, and they also reduce the swelling by constricting the blood vessels in your nose, which helps to open the airways. However, they have a drying effect on the whole body, including the mucus covering the vocal folds. Mucus is a viscous substance which has a protective function. If you dry it up, the vocal folds are more prone to vocal injuries. If possible, avoid using medications with a drying effect. If you need to use them, increase the intake of water to make up for their drying effect. Number 2, asthma medication. Asthma is often controlled by inhalers that contain steroids. Steroids are a group of drugs that help manage inflammation. However, voice problems as side effects of steroids use are well recognized. These include hoarseness, a loss of voice, and voice changes. It is recommended to rinse your mouth with water after taking the medications to prevent some side effects, but rinsing with water may not prevent hoarseness because the water doesn't come into contact with the mucosa of the vocal folds. If you have asthma and experience hoarseness, consult not only your respirologist but also a voice specialist who can help you manage the asthma symptoms while decreasing the toll on the voice. However, never change your meds without consulting your healthcare professionals first. Number 3, painkillers, and more specifically a group of drugs called non-steroid anti-inflammatory medications. Try to say it 3 times. Some examples of drugs are aspirin, ibuprofen, Motrin, Aleve, or naproxen. Some singers and professional voice users believe that these medications reduce vocal fold swelling, and they even take them as a preventative measure before high-demanding performances. It is true that these medications reduce swelling in joints and therefore reduce pain, but they also have an adverse effect on the voice. These meds increase the risk of bleeding because they inhibit aggregation of platelets that help blood clotting. When bleeding starts, it takes longer for the bleeding to stop while taking this medication. Prolonged bleeding on the vocal folds, for example from a vocal trauma, can lead to inflammation, scarring, or even cysts forming, and therefore can lead to hoarseness. If you need to take aspirin, ibuprofen, or other medications from this group, avoid sudden and high impact on the vocal folds such as yelling, coughing, or grunting. Also, avoid prolonged excessive voice use when taking these drugs. The risk is small, but there is a risk. If you need to take pain medication for whatever reason, ask your doctor if you can take Tylenol instead, which doesn't have this adverse effect. There are other groups of drugs that have known effects on voice. If you are not sure, talk to your pharmacist or doctor to make sure that the medications you are taking are not contributing to your voice problems. Bonus tip: many cough drops, throat lozenges, and sprays are drying to the mucous membrane of the mouth, throat, and vocal folds. Many of these products contain menthol and eucalyptus, which have a drying effect. Some lozenges also have a numbing effect, which can mask the underlying problem, making you more prone to vocal injuries due to overworking your voice. I made a video on this topic and you can watch it by clicking this link. I know that it may be complicated or even frustrating to manage certain health problems and keep your voice clear and healthy at the same time. If you have a serious illness, the priority is to control the disease or illness. And unfortunately, your voice takes the second place. But I also know that professional voice users who rely heavily on their voices perceive even slight hoarseness very debilitating. In cases like these, I encourage you to consult your doctor or even better, a team of specialists. Don't be afraid to tell them that your voice pays the bills and you need a solution that is least taxing on your voice. And that is all for today. I hope you found this video helpful. If so, give it thumbs up and check out my other videos right here below. And I will see you in the next video.